Christina He. I graduated from Arcadia University, class of 2014, which is just this past May, and I majored in health administration. Now I'm getting my doctorate in physical therapy at Arcadia University. The health administration program at Arcadia has definitely prepared me well for where I am at now. It's really been a great transition since I'm still on the same campus, and I still see a lot of my health administration professors that I've grown close to, so it's nice to keep close. When I was in high school, I was really looking for a diverse program, and health administration was where I wanted to be. I like bio, but I'm more of a business person, and I found Arcadia and I saw that they have health administration, and not a lot of schools that I was looking at even had anything like that. So it was really unique that they had this, and then I wanted to do physical therapy, so it was perfect for that. And we had that program all set, and I was like, okay, this works for me. So my initial plan 4 years ago, before I started college, was to open my own practice as a physical therapist, and being a health administration major has really helped me see like the business side of everything, which is what I learned a lot from there, like even from our health administration student society that we ran during my undergrad years. Like I learned so much through that, and it really opened my eyes to like a whole different field. Even when I'm a physical therapist, I can expand that way too in a business side rather than go more towards clinical care. So I can always be a health administrator, like even after hopefully I won't stop practicing, but yeah, I could eventually like manage my own practice. There's a lot that stood out to me, mainly with this program, is that it's very interpersonal, and I got to know my professors on a different level, and they were more like mentors with me, which was really great. So I had that part when I was coming to Arcadia. That's one of the main reasons why I came here. It's that interpersonal relationship that you have, and they're always there if I need any questions asked and everything like that. So that was great with that program. I always speak very highly of the health administration program here. Even when I was an ambassador for Arcadia, I was always like, you guys should do this. This is such a great opportunity. You'll separate yourself as an applicant for PT school. Like when I was applying to PT school, everyone was like biokinesiology, and then there was only me as a health administration major, and you don't find that a lot, and you can totally take advantage of this program. It's really great, really structured. The professors are great. The student society that we run to educate health administration undergrad students is really amazing. Like we did a lot of different trips. When I was an undergrad, we went to meet the Deputy Surgeon General in Johns Hopkins and DC area, and then we went to Medicare and Medicaid services, like the headquarters. So that was cool. Like this is such a great major, and I wish more people would learn more about it. And it's just a great route to take because you expand your options. When you become a health administration major, you will graduate and you have a higher chance of getting a job, especially in this economy. Healthcare is booming, and you can work in business in a hospital. So it's very diverse, and it's a really rich program and something really great to take away from here. I would definitely say that my leadership skills have greatly increased, and the program really allowed me to grow as a leader. I was the president of the Health Administration Student Society, so I was able to work on like planning things, like running meetings and everything of that nature. And I was really proud that I was part of that because I got to educate a lot of other health administration majors. Like when you're an undergrad, you really don't know what you're doing, but like our organization, we just like say, yeah, you're going in the right path, and there's so many other doors that can open with this path. So it was really nice that I had that, and I really had grown to have more confidence in myself because I chose the right field that worked for me. I think this major is the most beneficial if you're deciding, whether you're deciding to work in healthcare as like a policymaker or just being a physical therapist. It's a great pre-health profession major, and it sets you up for everything. Like, a lot of students assume, oh, because I'm doing pre-health, like pre-physical therapy or PA or whatever, I have to take a science route as an undergrad to prepare myself. That's not necessarily true. I'm in physical therapy grad school, and I feel like I'm at the same level because you do have to take your prerequisites for as an undergrad to apply to physical therapy school, so you're not missing out on any more than like the next person. So you're only getting a better application out of your process, you know?
My name is Christina Taylor, and I went to Arcadia for my undergraduate in health administration, and it sparked my interest in business, healthcare, and then I later went on to get my master's in health administration and public health. So that's the whole aspect of healthcare and business is really what I do today, and it really gave me the foundation I needed to get where I am. So Arcadia, at my time of 18 years old, looking to see where you're going to college, it was one of the few places that had a program in health administration. It was a very unique thing at the time, and this isn't all that long ago. It was business, and you had that ability to focus in healthcare, which is not something everyone has. A lot of times you go and you focus in business, and then do I focus in finance, accounting? But this allowed me to really hone in on my skills in the healthcare world. And healthcare is unique in the United States, it's unique in Ireland, in Europe, in Mexico, and everywhere you go. No matter where you are, you have business, and no matter where you are, you have healthcare. So to be able to combine the two and really differentiate myself from the rest of the business world was really an important thing for me to be able to do. So I have worked, throughout my time at Arcadia, I worked full-time for a physical therapy company, and after I graduated, I took on a position in their administration. So before I was more on their clinical side, I took a position in billing and human resources. I was able to grow and develop there. And then I took a position while I was in graduate school working for a patient safety firm, doing a lot of research and seeing what we do in healthcare that helps us grow as a business, what makes it cost efficient, what makes our healthcare things safe for our patients, what really drives patient-centered care. And then now I work at a cardiology firm doing work for Pennsylvania, Penn Medicine, and working to manage a group of cardiology practices to help really make our job patient-centered care as well as a very effectively run and efficient business. But my goal, I think, down the line is to continue to grow in my career path and eventually end up, in the executive kind of branch of things and see where that takes me, and where in hospital administration can I go, and where in the private sector can you go, and see what you can do to really make a name for medicine and make a name for healthcare in the Philadelphia region or anywhere else. One of the greatest assets, I think, when I was entering the program was the fact that you do an internship and what opens up those opportunities. And my internship really helped me get real-world experience that I was able to apply and put on my resume and help get me future positions. The other thing about the program is that with Arcadia, you have the option to study abroad. And while I was here, I did a 6-month study abroad in Ireland. And you get to see how their healthcare works, you get to see their culture and how everything comes together, and you got to take business classes there and see how that varied from your business classes here and get everyone's kind of different perspectives. So that was another really great aspect of this program, that you had the option to do that. They can expect to go through a very strong program that's going to prepare them for what they need to do in the real world. It's got a lot of real world applications. I tell my students still today, when we're learning this stuff, you're going to use it. It's not like you sit sometimes in a calculus class and you think that I'm just doing this to get through it. Every class you take in this program, everything you do, you're going to find a way to apply it, and you're going to need to apply it. So it really prepares you for what you need. I like Arcadia. I mean, it's a great program. I came back for a reason. I went here for a reason. I don't regret it any day of my life. So.
Hi, my name is Mitchell. I'm a Arcadia graduate of the class of 2014, and I'm currently in the Arcadia University Doctorate of Physical Therapy program. I believe that the healthcare administration degree just really puts a business sense into your head. Like, it really makes you focus on not only the science part of a degree, but also on the business part. Definitely with physical therapy prerequisites, you have to do a lot of biology and chemistry. But I think that taking a health administration degree as your major really makes you think differently than everybody else. You gain a lot of sense of how actual healthcare works, aside from the actual provider standpoint. It really puts you into the business aspect of it, and it really puts you at an advantage in terms of how much you comprehend already, how much real world experience you have, and just generally how much of an actual market you already are welcome to. Basically, it basically puts your foot in the door to a lot of places. I chose Arcadia because of the physical therapy program, but I also saw that it had a lot of that small school feel that I really wanted. And when I learned about the healthcare administration department, I knew that was exactly what I wanted to do. I wanted to get both sides of the relationship. I wanted the provider and I wanted the business side as well. As soon as I learned about the program, I immediately enrolled in it. And I think it was honestly the best decision of my college career. It really, I think, boosted me above and beyond in terms of not only how I thought, but also how I marketed myself, how I made connections, how I, learned how to interact with people. It's an incredible program. I mean, there's nothing like it. So I enrolled again back at Arcadia just because bottom line, I love the school. I know a lot of amazing people here. I met a lot of the physical therapy staff, and I knew that was the place that I wanted to be. The student to staff ratio is very low. It's extremely hands-on. They go above and beyond to help you. They make sure that you're getting it, and they make sure that you get all the resources that you would ever possibly need. And at the end of the day, they're just like they're a friend to you. You can talk to them about anything. I feel like I can come to my professors with absolutely anything, any concerns, comments, questions, anything. They're just always there. It's kind of like a family, and that's exactly what I wanted. I think personally, it really helped me kind of learn how to market myself professionally. It showed me how to kind of get my foot in the door in a lot of places, and how to really just be the professional that you need to be successful. I think it also really helped me in terms of it taught me how to kind of think outside the box. It definitely, absolutely taught me the value of making connections both in school and out of school. And I just think that everything combined really just put me, I guess, on a step above everybody else in terms of what I got from the healthcare administration field in general. Just even now in real world experience, I just find that I comprehend so much more just simply because of the degree. And I just remember, going over a lot of that either in class or in, just with a friend or anything like that. I just, it really applies itself very well to the real world. Expect to meet a lot of people. The healthcare administration field is a people's person field. You will meet everybody and anybody with amazing stories. Absolutely expect to just really get yourself out there and learn how to not be afraid to market yourself and learn how to make connections. Expect to be challenged, but in the good way that makes you grow. And I would say expect to love it, because it's just one of those fields that you kind of know that you belong to, and once you're in it, you know. And it's one of those things that'll kind of start to take over your life a little bit in a good way. You'll start to think about things differently. You'll start to approach tasks and, everyday life differently. You start to notice things you didn't before, and it's honestly the only major that I could have ever picked for myself, and it's the only career path that I think I could have taken. So the senior year project is basically a hospital disaster plan, and a lot of times thesis is really overwhelming for seniors, and they just kind of lose themselves in it, and they forget the whole main point, and that's to basically challenge you one last time before you enter like, you know, the next step, and it challenges you to grow. So with healthcare administration, with the thesis, you're not ever so overwhelmed that you forget why you're doing this. It's a good challenge. It's basically puts all your skills to the test, and when you accomplish it that day, when you walk out of that room after presenting, it's the greatest feeling ever. I mean, I still remember that to this day, and I remember the feeling of accomplishment of working with a group of 3 other people and just knowing that you did something great. That's the positive challenge of it. And yeah, absolutely, you'll be thinking about it a lot, and you'll definitely have your work cut out for you in terms of research and, you know, teamwork and, you know, figuring out dynamics and everything. But at the end of the day, when you really finish it and you walk out of that room at the end of that presentation, you feel completely, you know, different. Like it's undescribable.